that really leads us into a discussion about the variability of diagnostic equipment. I think you've got some flavor from Dr. Bergeson that it's not as easy as measuring every single grain of sand. We are often, with diagnostic equipment, using the latest technology to make the best estimation that we can based on the data that are coming back to the devices and using the algorithms to calculate the numbers. All equipment is subject to some kind of variability. Do you have a comment on that, Dr. Bergeson?
Yes, that's right. So you can think about the instruments that you commonly use in your sort of everyday experience. If you're trying to measure your blood pressure or your glucose or your body fat index or anything. If you're trying to measure even your thermostat, you're trying to regulate temperature in your house, there's always a little bit of uncertainty in these measurements.
Right, and there's usually a way, it's not completely out of your control. There are ways to reduce and manage through proper use, maintenance, calibration, how you actually use the equipment in the proper way to help you to sort of minimize that variation, because it will exist, and so that's where sort of training becomes important. Is our BioPhotonic scanner, the S3, more variable than other similar diagnostic equipment that you sort of face day to day? And then the second question we want to answer is this S3 version of the BioPhotonic scanner more variable than the S2? Some of you have asked that question, and we want to be able to answer that for you. So let's talk about some of the diagnostic equipment that you come across sort of every day. Not every doctor's office has a BioPhotonic scanner, but you've probably seen these blood pressure cuffs. And it might surprise you to know, I mean, they measure this basically every time you go to the doctor. And they do it once, right? You very rarely see them do it 2 or 3 times, to be sure. And yet it may surprise you to know that there's quite a bit of variability on this medical device. Research conducted on 7 different blood pressure cuffs showed as much as 30 millimeters of mercury difference. So how does that compare to the scanner? Well, if the scanner showed that level of accuracy between scanners, you'd see about a 30,000 point difference between scanners, right? You don't very often question the doctor and ask him to do it again or try a different blood pressure cuff, right? But it is giving the doctor or the nurse an indication of where your blood pressure is, right?
It's interesting because these variations also exist on automatic machines. So if you go to the doctor and you have them make the measurement not by hand using a blood pressure cuff like this where they put the stethoscope on your elbow and they try to make the measurement, but even the automatic machines, if you measure repeatedly, you get different numbers.
Right. And one of the reasons why they designed the automatic machine is because the nurse used to have to, or the doctor, listen to your the change in your heartbeat, right? As the cuff reduced in pressure, then you got the difference between the systolic and the diastolic. So it was open to a certain amount of subjectivity and skill on behalf of the operator. So automatic ones supposedly use a computer to reduce that variability, and yet we still see, quite a degree of difference. The body fat scales, this is electrolipography, right? Where you stand on the scales or you hold with your hand, sends a small current through your body to measure adipose tissue versus muscle. And here's a study in patients that found as much as a 5 to 7.5% difference in body fat between readings. This is one where, I've played with these a lot, and I'm really surprised at the variation. And in a typical, even a good quality body fat scale using this method, the equivalent of variation would be about 25,000 points if you compared it, if the S3 was as accurate. And our final example here is the glucose meter. A lot of people depend upon this. This is something where people are measuring their blood glucose, diabetics, and in 2011 the American Diabetes Association's position on the glucometer was that the total error could be as high as 15 milligrams per deciliter, or about 15%. So if we look at the amount of error by comparison to an S3, that'd be about 9,000 points. So you can see that variability is really sort of just a part, is what comes with the technology. But as I mentioned earlier, there are some things that you can do to sort of try to control this, a level of variability, right? So Let's look at some of the things that can give you what you might call a bad reading or a less accurate reading. High or low temperatures. Now with the S3, we're doing a lot better than we were with the S1. The S1 was highly variable to temperature, so we really had to have it in a very controlled environment. The S3 is much more robust, but it still does affect the the score to a certain extent. So having a normally heated room is important. And also, at this time of year, when you're tempted to leave your S3 scanner outside in the trunk of your car, probably not a good idea. Those cold, very extreme cold temperatures can also affect the readings in the scanner later on.
Yeah, and if you bring your scanner in from, say, the cold trunk of your car, you bring it into your apartment and let it warm up for a while, then it will be fine. But it's these extreme temperatures that can lead to some variability in the scoring.
Right. Improper hand placement is a big one. We're going to talk a little bit more about this, certainly at this meeting. Improper hand placement, so where you place the hand is important. The pressure is important. That's something that some of you may not have appreciated. How nervous you are, how tight you squeeze that poor S3 scanner can make a difference. Your posture while scanning actually affects the above 2 points, right? If you're sort of not seated comfortably with your elbow at the right angle, that's going to affect your hand placement, sometimes the pressure and the consistency of your hand placement. So it's important to follow those things.
There's actually some interesting work that we've done here when we think about sort of studies on the S3 scanner. So we recently concluded a study where we looked at 3,600 total scans. These were 10 different devices over several different people. We measured 30 scans on each device per session, and we did 3 different scan sessions on each subject over a 7-day period. And what's interesting is that when we look at all of this variability, just in repeated scans, and also the variability of the same person measured on a number of different machines, then the total variability is a little bit less than 2,000 points. So that's a relative standard deviation of about 3%. So it's important to remember that when you do these scans, there's going to be roughly a 15% total variability in terms of like the range of the measurements that you can get. And when you do the statistical analysis, this corresponds to a variability of about 2,000 points.
Right. Not too bad at all, especially when you consider the variation that you get from a typical medical device in your doctor's office or your glucose scan or whatever, right? And so as we mentioned, again, there are ways to control that, right? So it's not completely out of your hands.
No pun intended.
Yeah.
Okay, well, if you're actually going to turn on the scanner, and let's suppose that you wanted to repeatedly measure your hand 10 times, and let's suppose that your true hand value was somewhere in the range of, say, 41,000.
And what we mean by true hand value is, sort of theoretically, exactly what it should be. Like if you go back to the dunes of Pilat, you know exactly, how many grains are there. But again, the scanner is sort of making an estimate of that, right? So true hand value would be equivalent to the true number of colored grains on the beach, right?
That's right. So this little measurement series that we've shown is actually, these are 10 real scans on a real person on an S3. And if you average them together, then they indicate your true hand value, which is about, in this case, 41,000 for this subject. And this range of measurements that you get corresponds to plus or minus 1 color shade, and it does that 85% of the time. It's interesting to think about what variability means, and I'm not sure exactly how much math you want to sit through here, but briefly, the short story is that the measurements that we see on the scanner form what scientists love to call a normal distribution. What that means is that in repeated subsequent measurements, some measurements will be a little bit high and some measurements will be a little bit low. And if you put them all together, you can get an average. But as you can see on this slide, there's also going to be sort of a characteristic spread in the data, some high and some low. And this is the kind of variability that we see on these scanners. And by averaging together, we are able to get confidence in the ability to make a measurement. Now, if you make only one measurement, it's like just pulling one number out of this distribution. There's a chance that it'll be high or low, or a chance that it'll be right on. But you need to know that sort of 85% of the time, it's going to be within one color shade of the true hand value.
Right. And this is something that, again, we deal with all diagnostic devices. But you don't often hear your doctor complaining too much about the variability of the blood pressure cuff or anything else. We just know that it's there, and we're using our best technology to measure it, right? So let's then compare. Let's look at the variability on the S2 scanner. Is it the same? Is it better? Is it worse than what we see on the S3? So we've done the same sort of study on the S2, right? Dr. Bergeson?
Yeah, this is a slightly smaller study, but it's indicative. So this was 450 total scans. It was 5 different S2 devices. We did 30 scans on each device in each session, and we did 3 different scan sessions on each of the people in the study for over a 7-day period. And what we find is a similar variability as what we saw with the S3. Actually, the S3 is a little bit better. So the S2 is a slightly larger range. When you do the statistical analysis, you see instead of roughly 2,000 points, it's a little bit bigger. It's closer to 2,500 points.
Yeah, and there's a reason for that, actually. So the technology is basically the same. We're still using the LED light source, right, with narrow bandwidth filters. But Dr. Bergeson can comment on some of the additional changes that we made when we transitioned from the S2 to the S3 technology. Of course, the goal was to get a smaller device, something that was lighter, but during that, that development, we were able to increase and improve the technology somewhat, right?
Yeah, that's right. So the S2 and the S3 both use these narrowband LED sources to send light to the hand. And when we built the S3, we used the newest light sources, the brightest light sources. We used the best filter technology. The optical path is re-engineered to have even higher throughput to give us the highest possible accuracy in these instruments.
Right, so, a slight improvement according to all of our data. And, it takes a lot of individuals a lot of time to do these scans. Even at 30 seconds a scan, or in the case of the S2, more, this is really quite a process, and it's something that we feel that is important because we know that that distributors who are using this device really want to be able to trust it, and we need to know exactly how it's behaving. So that's one reason why we do these tests. And again, just to cap up here on the S2, the same things that can give you a bad reading on the S3 were applicable to the S2. High or low temperatures, improper hand placement, and allowing it to acclimate, right? So these are some of the same things that you can do to control whether or not you get the best reading possible within those lines from the graph that Dr. Bergeson showed, or unfortunately, if not done properly, outside somewhat. So let's talk a little bit about hand placement. Now, something that you probably appreciate is that the carotenoid levels, the actual carotenoid levels, vary somewhat all over the body. We have chosen to scan the hand. It's a great place to scan the palm of the hand, especially. It's less subject to changes, because of a tan in the summer and the winter, things like that. But if you were to scan your face, you would probably see a different score. If you were to scan the bridge of your nose versus your cheek, you would probably see different scores because the carotenoids vary somewhat through the body. That's a different story. But just looking at the hand, there is some variation, even in the palm of the hand, about the actual score. So the idea is to choose a spot and be consistent in the placement. So we've done an experiment here that just showed the placement of your hand, 0.5 centimeter to the left or the right, or up or down. You can see from these numbers here makes a difference. Now, if you don't like looking at these numbers, and perhaps we'll leave this slideshow to be available for you in the future so that you can scrutinize those numbers a little bit. But let's make it a little easier by looking at a graph that shows what happens when you change your hand placement. So here you can see the colors of the scan. This individual is scanning, somewhat in the green, I guess, 40-something thousand. And let's say your ideal spot, the first place that you scan, is going to be target number 1. You see you're scanning at 41 or 2,000 there. If you move your hand half a centimeter to the left, it's not very far, is it? You're going to get a slightly higher reading. Half a centimeter to the right of that target, and it's a little more accurate, a little closer, but still not dead on. If you go up or down, it seems to make an even bigger difference in this experiment, at least. Half a centimeter up, half a centimeter down, you see a change. So the idea here is just to be consistent in the placement. And you can see from the diagram of the hand, there's a line that goes across most people's hands, a crease, and some people call that the heart line. We use that as a guide for placement. Don't put it on that heart line, because that crease there will sort of won't allow you to trap the light properly, but just somewhere in relation to that line, and help people to put it in the same place every time. This actually necessitates that you're a little bit intimate with your scanner patient, right, your customer. Don't be afraid to reposition their hand. People will sort of grab the scanner and they're really not sure where to put the hand. I usually sort of peel the hand away a little bit, look at the heart line, reposition, and then gently put the hand back and tell people how to place the hand.
One thing that's interesting about these hand placement studies is that the amount of variability depends strongly on the individual. Some people show strong variability as they move their hand around just even a few millimeters, and other people don't show any. But the best practice then is always try to hit the same scan spot every single time.
Yeah, that's a really good point. There's a lot of variation between individuals. The pressure, this is one that actually surprised me a little bit. The actual pressure that you have, the hand pressure on the BioPhotonic scanner, does affect the scanner score. So let's look at these 3. I assume that these are the same subject, but actually different hand pressure. That's correct. So you can see that light pressure versus hard pressure can give you a variation. I've got to be honest here, we're not exactly sure why that is. There's some speculation about why the hand pressure varies. Certainly if pressure is too light, you may have the opportunity of light to get in, which would interfere with the scan. We're not exactly sure why it is, but again, the take-home message is not too light, and just make it consistent.
And again, here it's another interesting thing that there are some people who, when they use a high pressure, pressing on the probe with their hand, they see a dramatic change in the score, and other people see no change in their score. So, as an example, I have almost no pressure effect, but my colleague, Justin Petrus, has a strong pressure effect. We don't understand why that is.
Yeah. But that's a good observation, right? And it will help you to, again, control the variability of the scores that you have amongst your customers. Here's just another way to...
so this is just a sequence of 10 measurements with high pressure and low pressure on the probe. And you can see that for this particular measurement series, the person measuring had a strong variation with pressure.
Right. Temperature, we've already sort of mentioned this, but here's just sort of a more graphic representation of some of the experiments that we've done that show that if the scanner is too cold or too hot, that it can affect the accuracy and impact the variability of the score. So these days, not too much of a problem, right? We have central heating and cooling in most places around the world. So it's something that you can control. Now, I guess the question is, you're going to have sometimes some fussy scanners, some people that, by that I mean individuals that sort of are worried about their score seeming too high or too low. What can you do about that? Well, we've already mentioned steps that you can take to control the variability. That's really I think, the #1 take-home message of this presentation today. But there are things that you can do. I guess this is sort of a be your own scientist kind of advice here, right? If someone's score seems too high or too low, then one thing that you can do is scan 3 times or more, and then take an average to determine an estimate for this true hand value. And you might also want to explain scanner variability, what you know about diagnostic devices now. Having been through this presentation, you know that various common devices that you encounter every day, like the blood pressure cuff or electrolipography, there's variability, and that's the nature of any diagnostic or electronic device here.
Yeah, so let me just comment here. So this is that scan record that we show. This is 100 scans, and the average of this is around 40,000. But you can see that there's a variability, and the total range of scores goes from about 35,000 up to almost 45,000. So it's a kind of a 9 or 10,000 point total spread in the data. And if you just measured one time on this person, there's, you could get really high or really low, just according to this. But one thing that can happen is that if you were to measure 3 scans in a row, this is that same measurement sequence. If you just measure 3 times in a row and average those 3 measurements, the variability goes down dramatically. And so the uncertainty, if you want to think about, well, if I measure once, what's the uncertainty in the measurement? And it's going to be, well, it's going to be plus or minus 1 color shade. But if you measure repeatedly and you take the average, then the uncertainty in that average becomes very small.
All right. So, again, hopefully you don't have to do that with everyone, but you're going to come across some fussy people that may be a little bit more skeptical, and that's a good way to do it. Keeping in mind variability and those sort of principles that we've already shared with you. So let's just recap then on scanner variability. From our studies in our hands, and these are very exhaustive, time-consuming studies, well-controlled, both the S2 and the S3 devices have variability levels that are actually superior or comparable to other similar measurement devices that you'd find in the market today. There are other existing carotenoid diagnostic tools that have less variability than the S2 or 3, and these would include high-performance liquid chromatography and blood serum draws. While we make this statement, we've also done comparisons there and found that this is not actually as big as you'd think. Blood draws are slightly more accurate, perhaps, but in some studies, actually even less. So it's fairly comparable. But bottom line is that these tools are very expensive and very invasive. You're taking blood draws and take a long time. So, obviously the camera that we have taking photos of the sand is a lot better alternative. And again, in our hands, with all of the studies that we've done, the S3 is not more variable than the S2. So repeated experiments have shown, again and again, a tendency for the S3 to be slightly less variable than the S2 overall. There is a tendency for us, I know that the S3 has been on the market for 7 months. Many of you have been using the S2 for several years. There's a tendency to think that it's more trustworthy and more accurate, less variable. But again, an objective look from our study shows that it's about the same.